Well, good morning, everybody, and let me say how proud I am of the strong UK history in genomics, from the discovery of DNA structure to helping sequence the first human genome. But history isn't enough, as we've heard already from Nicola and Rich, and thank you both for your very warm welcome to me today. Because I, and I hope you are too, I am excited for the future. And that excitement, I believe, is represented in this room as well as outside. And it's about, for me, an NHS that is fit for the future, that can withstand the new demands and increasing demands, and can also can provide for the people of the UK exactly what they need and deserve. And I am also excited, and Rich and Nicola talked about this, about a UK that is, in my words, the place to be when it comes to this work. And I believe that you represent that. So it's wonderful to be here. It feels good. It follows on for me from the NHS Genomics Healthcare Summit in December and the Festival of Genomics in January. I am always inspired to be amongst and to see so many leaders and innovators and those who are directly affected in their own lives. And for everybody to be coming together to celebrate advances in genomic medicine, and also to have a close look at the benefits that flow from that and what more is possible. Because as Nicola said, it is about scale. It is about embracing progress, and it is about delivering. If it's not about those things, we have to ask ourselves, what is it for? So I would say, colleagues, we haven't stood still. We've built on what we do have as a great legacy in this country through investment and partnerships to drive the genomics revolution forward. And these efforts enable earlier disease detection. They support the next generation of therapies for cancer and rare conditions. And key to all this, it gives hope and positive outcomes for patients and their loved ones. So I can assure you that our government is committed to maintaining and growing our world-leading position in genomics, and that will be reflected in two upcoming strategies: the Life Sciences Sector Plan and the 10-year Health Plan. And when I think back to when we took office nearly a year ago, oh how time flies, I can tell you that we've prioritised high growth sectors where the UK has strengths. Life sciences is one of the most dynamic and the most innovative industries in our country, which is why it's one of the 8 priority sectors in our industrial strategy and has its own dedicated plan. And what will that plan do? Well, it will set a clear direction for the next decade, removing barriers to growth, improving health outcomes, cementing the UK's global leadership in life sciences, and it's being developed alongside the 10-year health plan to align our health and growth missions. So with the 10-year plan, which you won't have to wait too long to see, there will be a great focus on delivering 3 key shifts that will make that NHS that we know and love fit for the future. And let me say what I'm sure is obvious but always bears repeating: the NHS cannot do this alone, the government cannot do it alone. And Genomics England, our host today, are central to enabling and accelerating each of these 3 shifts, as we have already heard. So shift 1, analogue to digital. Genomics England provides the digital infrastructure that enables whole genome sequencing in the NHS. With patient consent, this data will power research and diagnostics. And thanks to the infrastructure, over 1,000 research projects are underway, already delivering over 4,000 new diagnoses. What does a diagnosis represent? It's nothing abstract. What it does is it brings answers, it brings hope, and it brings direction to thousands of families. And we've also committed to using the NHS's unique health data for patient benefit. That's why, and you may remember this, the Prime Minister recently announced a new health data research service backed by some £600 million. And what will that do? Well, it will create the world's most advanced, most secure and AI-ready health data platform. And these vast data sets are absolutely essential when it comes to powering genomics and training AI systems that are absolutely transforming healthcare. And again, you are at the heart of that. Shift 2, hospital to community. Genomic screening supports more personalised care closer to home. It helps GPs, it helps community teams predict risks and manage long-term conditions before hospital is needed. And the generation study, of which we've heard much this morning, and let me add my thanks to the 12,000 participants, what a difference you are making. The generation study is already evaluating whole genome sequencing in newborn screening and showing how we can detect diseases earlier, how we can prevent progression, and how we can reduce hospital admissions. And then shift 3, sickness to prevention. And we've heard a lot about that this morning, and I was very glad to do so, because by detecting treatable genetic conditions at birth, what we know is we can intervene early to stop or slow disease. Genomics also helps identify cancer risk and to diagnose rare diseases. So getting the right care to the right people at the right time, not leaving it to chance. That is the essence of a healthcare system that puts prevention first. So, as I hope you can tell, I'm genuinely excited by the role that genomics will play in these 3 shifts. Indeed, without genomics, we won't fully succeed in these 3 shifts. And I'm grateful for the continued commitment of Genomics England and the support of the NHS Genomic Medicine Service. Together, they've moved genomics, moved it from a niche speciality that's spoken about over there, that's some scientific thing that the rest of us who are not scientists don't understand. It's moved to being a core part of routine care. This is about turning scientific ambition, and you'll hear much of this today, into real-world progress, making it a patient-focused ambition. So this is but a glimpse of how genomics will help deliver our 10-year health plan, and I look forward to sharing more once that plan is published. So, colleagues, what we always need to hold close to our hearts is that genomics is all about patients. And later, families whose stories show the real impact of your work will share their experience. And I want to thank those families in advance for the courage to speak and also for reminding us why this matters. They are the reason that any of us do what we do. And let me also thank the brilliant researchers and innovators and many others who are here today. Your work ensures that people across the UK benefit from genomic medicine. And I feel positive that we will build an NHS that brings the latest research to patients and without delay. Thank you so much for being part of it. Thank you.